So when we're talking about inflammation, let's think about what happens when a surgeon makes an incision for any operation. They open the skin, they do their operation, and then they close the skin with sutures or staples. And what's happening internally from a biological perspective is the white blood cells are flooding the area in response to the injury, and they are secreting little tiny peptides, little tiny pieces of protein that interact with the skin cells to begin the repair process. And each peptide has a specific job. So one peptide stimulates the production of collagen 1, another one reticulin, another one collagen 3. And at the same time, the injury has caused edema or swelling in the tissue, and that flooding of fluid into the subcutaneous area allows for the free flow of all of these healing molecules. When all of these molecules are migrating through the subcutaneous tissue in order to heal the skin, you're relying on the immune response to repair the injury. So when we go into the science of dermatology and plastic surgery, whether you're talking about microneedling, which is hundreds of little tiny punctures and wounds in the skin, or lasering, which is introducing light energy into the skin that causes heating and burning, whether you're talking about high intensity fractal lasers, all of those are procedures that injure the skin, and we take advantage of the fact that the body will heal itself given the appropriate environment.